All right, so we are going to look first and foremost at this bone, which generically we're going to call our collarbone, but formally called the clavicle. So the clavicle, there aren't too many features to know. The one thing we need to know is the sternal end. Now it's easier to look at the sternal end from an end cap view. So see how it's wider and sort of taller. And this is called the sternal end because it meets up to the sternum or my breastbone. The other end, which is thinner and narrower, comes more to a point, as you can see from an end view, is the acromial end. And this is going to end and form a joint with the acromial process of my scapula. So this is lateral, this is medial. Now to tell superior, inferior of a clavicle, the superior surface is much more smooth. The inferior surface will have more roughened texture to it. So to put this in proper position, the inferior surface has to be put down or inferior. Acromion has to be out. Sternal end has to be medial. So this in me would be my left clavicle. Moving on to the scapula. So two things to recognize for the scapula. One, we want to determine anterior from posterior. The anterior surface, this area here, is going to also be called the subscapular fossa or the costal surface because the ribs are going to come in contact with this subscapular fossa. The posterior surface is easy to identify because it has this big structure right here, which is the spine of the scapula. So above the spine, superior to the spine, is the supraspinous fossa. Inferior to the spine is the infraspinous fossa. So again, this is the posterior side. Now, this is another bone we have to know right from left. So one of the easiest way to determine right from left is to identify the spine of the scapula, which has to point posteriorly. And this feature right here called the glenoid cavity, that is what's going to articulate with the head of the humerus. So this has to point laterally. So for me, this would be, for this to go posterior and that to be outside, this is going to be my right scapula. If I put it on my left side, notice that the glenoid cavity points in towards my spine. So that's no good. All right, so if we continue off the spine of the scapula, we get this process, which is posterior. This is called your acromion process. And anterior, this other process is called the coracoid process. So posterior acromion process, this is what hooks up to the acromial end of the clavicle. Anterior coracoid process. Going back to our glenoid cavity here, you're going to have a little roughened area just above the glenoid cavity called the supra, for superior, glenoid tuberosity. Just below it, you're going to have the inferior glenoid tuberosity. Borders of the scapula. Remember, this is always lateral. So here is my lateral border, right, as a whole. Lateral angle is just this area right here. Here's my inferior angle of the scapula. Here's my medial or vertebral border of the scapula because it comes up in contact with the vertebra. And remember, this was the lateral or axillary border. Here's my superior border of the scapula, and then I have my superior angle. Now the superior angle can be divided in two. If I go from here to here, this is my superior lateral angle going towards the glenoid cavity. If I go from here to here, superior medial angle going towards the medial border. The only other feature you have to know for the scapula is this tiny little notch right here, better seen right there. And that is called the suprascapular or scapular notch. Now, we're going to continue with the humerus. Humerus, aka the funny bone, right? Rather significant bone in terms of size in the upper extremity. And we're going to first determine if this is a proximal or a distal end. So the proximal end is identifiable by this large rounded structure, kind of looks like a giant trailer hitch. This is called the head of the humerus. This is the proximal end. This would be my distal end, and this is going to be the part that makes my elbow joint. Now, to determine right from left when it comes to the humerus, you're going to have two features that you use. The head of the humerus, which we just introduced you to, has to point medially. And at the distal end, if you look, there's one side that has two smaller indentations. There's one side that has a very large indentation. The large indentation is called the olecranon fossa, and it has to face posterior. So for me, in anatomical position, for my head to point medially and my olecranon process to be towards the posterior side, this is going to be my right humerus. Now, if we go back to the head, just like your head is on your neck, same thing for the humerus, only the humerus has two necks. So we have the head of the humerus, the anatomical neck, if I draw a ring right around here. you have the surgical neck here, called the surgical neck because that's the most common place where we have fractures and surgery must be performed. Now, going to the anterior surface, again, that's the side with the two little indentations, you have the greater and lesser tubercle. So remember, the lesser is a little bit lower, and between them, you have this intertubercular groove or intertubercular sulcus or bicipital groove, whatever name of those you choose. Coming down from there, continuing on the anterior surface, you have a little roughened area right here. So you can feel it with your finger, but it also looks rough in texture. This is your deltoid tuberosity. This is where your deltoid muscle, your shoulder cap muscle, comes to attach and rubs against this area. Now, if we continue down from there, we're going to have at the distal end, the medial and lateral epicondyle. So medial epicondyle, think same side as the head of the humerus. Lateral epicondyle, obviously the opposite side. Trochlea here looks like a spool of thread. It's on the same side as the medial head. Above the trochlea, larger of the two indentations anteriorly, coronoid fossa. Next to the trochlea, so lateral, you have this that looks like a miniature version of this head. This is called the capitulum. Caput in Latin means head. And above the capitulum, you have a little indentation called the radial fossa. Last but not least, going back to the medial epicondyle, just above it, you have the medial epicondylar ridge. And above the lateral epicondyle, you have the lateral epicondylar ridge. All right, so those should be all your features for the humerus. So now we're going to move over to the ulna. I'm just going to scroll my sheet up a little bit. All right, I just want to make sure I don't forget any features to tell you. All right, so for the ulna, again, we got to determine proximal from distal. So the proximal end is the end that looks like a wrench. I kind of think it looks like Pac-Man when you look at it from the side. So the top lip of Pac-Man, if you will, this is called the olecranon process. The bottom lip of Pac-Man is called the coronoid process. The mouth of Pac-Man, so where I'm sticking my finger here, that's called the trochlear notch. Just to the side of the coronoid process, you will see this little notch taken out. That's the radial notch. That is where the head of the radius literally rests against the radial notch. That's why it's formed. Just below the lip of the coronoid process, you have the ulnar tuberosity. So this little bump out right here, a little roughened, rounded area. You're going to then feel a very sharp border in the middle of the shaft here. This is called the interosseous border. And at the distal end, you're going to have a little spike of bone that sticks out. That's called the styloid process. You can palpate that on yourself. It's on the wrist and on the pinky side, and you can feel this little bump out right there. That's called the styloid process. Then you have the head of the ulna here and the surface for the fibrocartilage disc. So that would be your ulna. Now, to determine right from left in the ulna, you have to know a couple things. Your ulna is in anatomical position your medial forearm bone. So it's on the same side as your pinky. So always remember PU something stinks, right? So if you line up the ulna so that this is your proximal end, this is your distal end, same side as your pinky, the radial notch has to point lateral. So for me, this would be my right ulna. Why? Because again, the radial notch has to hook up with the radius, which is on the thumb side. If I were to put this on my left side, look at where the radial notch is. It's over here, and it's got to hook up with my radius, which is over there. Second to last bone we got to cover here is our radius. So radius is kind of identifiable because it has this like flat mushroom kind of shaped head. So this is the head of the radius. This is the proximal end. In the top of the head, you have this little indentation called the fovea. So this little indentation at the top of the head of the radius. You have, just like you have a head on a neck, the radius's head is on its neck right here. And on the anterior surface, again, you'll see a round, roughened area. This is called the radial tuberosity. And the radial tuberosity is on the same side as the anterior surface. And you can always tell the anterior surface has got this big, flat area down here at the distal end. Posterior surface is obviously then underneath. Now, if we look at the distal end, you're going to have two things. You're going to have a styloid process. As you can see, the styloid process bumps down a little bit further. Not quite as prominent as it did with the ulna, but definitely identifiable. And then instead of a radial notch, you're going to have an ulnar notch, right? So here's my ulnar notch. And again, that is made by the fact that your ulna rests there, so to speak. So just like that, and that's what creates the ulnar notch. Now, to determine right from left, again, Remember that this is going to be on the thumb side of the forearm. This has got to be my anterior surface, the flat side, and that is going to have this because the ulnar notch has to face the ulna. So this has got to be my right radius, again, because this is anterior, and here's my ulnar notch right here, which faces towards the ulna. If I were putting this on my left in proper position, the ulnar notch would face out and it would have no ulna to hook up with. Last feature on the radius that we have to know are these two little tubercles here known as the distal tubercles, these little tiny bumps right here. So distal tubercles of the radius. Last and not least, right, we have the carpal bones. The carpal bones are going to be always bones that are cube shaped of sorts. There's 8 of them, and they are always noted to be in 2 rows of 4. We have a proximal row of carpal bones, and we have a distal row of carpal bones. So you always start thumb to pinky and then come back for the distal row, thumb to pinky. So this one that kind of looks like a little U or comma shaped, that's our first bone, scaphoid lunate triquetral pisiform. So notice that the pisiform is on top of the triquetral bone. So some levers try positions. Scaphoid lunate triquetral pisiform. Then we go back to the thumb side that they can't handle. Trapezium, trapezoid, capitate, hamate. Hamate's always identifiable because it has this nice little hook on it. Okay, so again, in order 1 to 4 for proximal row, scaphoid, lunate, triquetral, pisiform. Distal row, trapezium, trapezoid, capitate, hamate. Now, metacarpals, you always have 5. We're going to call these the meat of the hand, right? That main hand bones, the palm of your hand. There are 5. They are numbered 1 through 5. 1 is always the great thumb. Okay, so first metacarpal, second metacarpal, third metacarpal, fourth metacarpal, fifth metacarpal. Phalanges, you may look at your hand and say, I have 5. But if you notice, you have indentational lines where all your phalanges are. So you actually have 14 of these. Why not 15? Because digit 1, which is your thumb, only has a proximal phalange and a distal. So proper naming of the phalanges is always number, position, name of bone. So first proximal phalange, first distal phalange. Digits 2, 3, 4, and 5, they have 3 phalanges. So for instance, this would be my second proximal phalange, my second middle or intermediate phalange, and my second distal phalange. This would be my 5th proximal phalange, my 5th middle or intermediate phalange, my 5th distal phalange.